In order to understand asynchrony on mechanical ventilation, we need to look at the ventilator and the respiratory system of the patient as a dual pump system. And what we mean by that is that if the patient is intubated on mechanical ventilation, the forces that need to be overcome in order to get the air in are the resistive forces of the airways and the elastic forces of the lungs and chest wall. If the patient is not breathing, in order to overcome these forces, the ventilator has to apply a positive pressure. The transpulmonary pressure will be this pressure that is applied by the ventilator minus the intrathoracic pressure, and since the patient is not breathing, we assume it is 0. However, if the patient started to breathe, we add another pump to the ventilator pump. Now the patient is able to generate a negative pressure, so that transpulmonary pressure will be the ventilator pressure minus the intrathoracic pressure that is generated by the patient. And if we want to look at the equation of motion, where on this one side of the equation is the change of the pressure, which is the pressure on the ventilator plus the pressure that is generated by the patient when the patient is breathing. This pressure would be equivalent to the resistance of the airways multiplied by the flow plus the change in tidal volume divided by static compliance. So on volume control mode of ventilation, if the patient is not breathing, the machine will deliver whatever pressure is needed to overcome the resistance, the flow, and the static compliance. If the patient started to breathe, that pressure delivered by the machine will be less because the patient is adding his own pressure now to overcome this resistive and elastic forces. On the other hand, if the patient is on pressure control mode of ventilation, the pressure that is set on the machine will be fixed regardless whether the patient is breathing or not. And if the patient started to breathe, because that patient's intrathoracic pressure will be added to the ventilator pressure, the change of the pressure here will be larger, and this will result into larger tidal volume delivered to the patient, provided that the resistance and the compliance have not changed. Now, this asynchrony can happen during any time during the respiratory cycle. So you can see here that the patient is breathing in inspiration and the patient here is breathing in expiration. This is the muscular pressure that is generated by the patient, and you can see that the patient starts a breath here. He continues to have a negative pressure here inside his esophagus, and also during expiration on the ventilatory breath, the patient is also initiating inspiratory efforts that pushes this expiratory flow to the baseline. So it is very important that we look at the respiratory system as dual pump. The first one is mechanical ventilation and the second one is the patient. Our intention would be always to minimize sedation for the patient so he can participate in breathing. The understanding of this dual pump would be at most important when the patient is more awake and is able to breathe. Thank you.